we have a lot to cover. You want to?
Let's get started. And
yeah, okay, let's get started. Okay, it's about 2 minutes after 9, but let's start. Okay, I want to just I'm going to open this up and then pass it to Liron and the speakers. Welcome everybody to the Foundation Forum call today. Our subject is public health gaps. Public health gaps in Arab society. I'm Howard Sohn, and I'm the executive of the FOS Foundation and currently chair the Task Force's Foundation Forum. Some of you were with us on Monday's call about the vaccine rollout. And you heard there about the challenges, number of challenges to in the healthcare arena, including access to medical services in many Arab communities, and the higher risk of COVID illness, higher risk due to pre-existing conditions. We heard reference to the need for culturally adapted health services, and a number of other challenges related to overall gaps. Our forum has never, our foundation forum has not really dedicated attention to health gaps in the past. We've looked at a broad array of socio-economic priorities in Arab society, focusing often on employment issues, education, higher education, capacity building at the local level, planning, infrastructure, a whole range of things that affect the broader range of gaps. But now we want to spend today and some other efforts of the task force on this these health gaps, which are so very, very important. We're fortunate to have with us today 2 senior representatives of Israel's public health and from the medical arena in Israel, who will, I'm sure, shed some light for us on how and why health gaps are receiving new priority, why narrowing these gaps is such a priority. Was becoming that even before the coronavirus, but now magnified by this recent experience, this current experience. So we're happy to have with us Shlomit Avni-Vaknin, who is from the Ministry of Health, where she directs the Policy and Planning Division, which is within the Strategic and Economic Planning Administration. This effort she directs is dedicated to narrowing health gaps in Israel. And we're also fortunate to have Dr. Fahed Hakim, who's the director of the EMMS Nazareth Hospital.
Bankruptcy, closure, divorce.
Could those of you, we need to ask everybody to mute their phones if they would, or mute their computers, mute their audio. So Shlomit, I'm sorry, Dr. Hakim is at the EMMS Hospital in Nazareth, the largest medical facility in Arab society in Israel. He's a pediatric pulmonologist and a member of the Technion Medical School faculty. We're delighted to have both of you with us. And before you do your presentations, though, Liron has a few words of introduction as well.
Thank you, Howard. Hello, everyone, and welcome. I will be very brief. Just to say, it's really a pleasure to have Shlomit and Dr. Hakim with us. Thank you both for joining in such a busy week. Both speakers will have about 10 minutes. Then we set ample time for Q&A, because what we were hoping to do early in the year is to bring this issue to have it's a new issue. We wanted to put it on the table and give a bit of time. It intersects with so many other social and economic trends that we've been following, from employment, early childhood, paramedical professions, higher education. Today we're going to get we're really lucky to have an overview, and we're going to have time hopefully to both start to unpack those threads and see what we want to follow up with later. And to introduce the speakers and moderate the panel, I want to invite our Israel representative, Ilan Amit. For those of you who have not met him yet, Ilan, he brings the task force expertise in public health issues, specifically as well in the South. So it is totally appropriate and right for him to introduce the speakers and the issue and take it away. Thank you very much, Ilan.
Hi, everyone. Thank you for joining us. I'll be very quick because I want to leave the floor for our speakers. Thank you for joining us. I'll just say quickly that as a group of people, founders in Israel and in the US, concerned with development in Arab society, concerned with current issues in Arab society in Israel, gaps in health is a field that touches pretty much each and every field we work in. Access to higher education, labor market, early childhood. And I'm honored to bring this very interesting piece of presentation to this group. With no further ado, Shlomit, please go ahead.
So thank you, everyone, and good afternoon. It's evening here. I'd like to share a screen if it's okay. Just a second, please. Tell me if you're seeing this. Are you seeing my presentation? Great.
Yes, we do.
So
yeah.
I'll give an overview about the issue of health gaps and the Arab minorities' health in Israel, and I want to convince you that this is a strategic issue. At least we in the Ministry of Health have identified it and been working on it for the past few years. I'll say in general that the Ministry of Health looks at the issue of health disparities between different groups in Israel as a strategic issue since 2010. And specifically, we've been focusing on the issue of health gaps with the Arab society in Israel in the past 2 years. And we've been seeing very worrying outcomes that I want to share with you and try to describe how we're tackling it in the government and maybe convince you that this is something that should be seen as a joint action, because we believe in cross-ministerial and cross-sectional work on the issue of health gaps. And you'll see how we do it in just a second. So maybe I'll start with something general, which is when looking at health outcomes, in Israel, you can see low health outcomes in almost everything that we measure in the Arab society. And I'm referring here to the Muslim Arabs, the Bedouin Arabs in the south. I'm also talking about the Arab society in the north. And this is something that is, you can look at it as something that's accumulated in a lot of fields. And we've been seeing these health gaps since maybe the day they've been measured, but we've not been seeing any narrowing of these health gaps. Now, although these health gaps are here, not a lot of action, governmental action has been taken forward in the past few years. There were a few governmental actions that provide partial and short-term solutions regarding health, but there isn't a holistic, or there wasn't up till 2 years, a holistic or substantial response. And we've seen that governmental resolutions haven't put health as a strategic issue to deal with. Now, looking just at a few of our challenges, I'd like to maybe state before that a few of our advantages or our pluses in the health system. But you know, it is important to state that we have universal care. We have very strong 4 HMOs. Professor Hakim will talk about the hospitalization system, which is very strong as well. But we have good substantial outcomes, but then when looking at the gap, sorry. But then when looking at the gaps, especially between Jews and Arabs, we've been seeing substantial gaps. Now, another plus that is worth mentioning is the issue of the integration of the Arab society into the health workforce. We've been seeing a lot of physicians among the Arab society, a lot of nurses, but we're still seeing critical lack of Arabs in a few fields such as mental health, psychologists, psychiatrists, etc. Now, when looking at the availability of healthcare services, when you look at Arab towns, it's counterintuitive, but we have been seeing higher availability in general practice and child's health in all or most Arab towns. But when looking specifically at the Negev Bedouin society, we've been seeing challenges, especially in the unrecognized and recognized villages, as opposed to the towns. But in general, we have a good general and child's health services. They're spread out pretty well. But still, what are the challenges? And I'll give really only a few examples. So let's start with the issue of life expectancy. There's a gap between Arab women and Jewish women, as well as Arab men and Jewish men. We have been seeing a bit of improvement in the past 3 years, the narrowing of this gap, mainly to do, I think, with actions that we've been Arab women, but still this gap is consistent. And most of it has to do with the issue of disparities in infant mortality, which can be up to 3 times higher in Arab society in the south of Israel among the Bedouin society. We've been seeing 40% of Arab women over 65 are diabetic. This is a very, very big issue. 40% of Arab men are smokers. Okay, and you can see the data about, let's say, the Jewish men, which is 30%. You could see the issue of overweight at 7th grade between the Arab society compared to 7th grade among Jewish children, much, much higher. And we can look at the early years and see the mortality rate mainly because of external reasons such as car accidents, etc., which is much higher amongst children in the Arab society. And I could have given you about 100 more examples. Again, almost every outcome we look, except the issue of cancer, but then we could talk about breast cancer among Arab women, which is a problem. But almost at anything that I look at, when looking at outcomes, there is much worse outcomes amongst the Arab population. So looking at that, I want to tell you what we focus on in the Ministry of Health. We decided to focus on the issues that you can see before you. These are, sorry, I have noise outside. These are 5 content focuses: the issue of diabetes and overweight, mental health, smoking, early childhood, and maternity health and women's health. And we are also looking at, and these are cross-sectional, of course, the strategic level, meaning how we can promote research on Arab health, how we look at the health services infrastructure, how we look at workforce where things are scarce, for example, the issue of mental health workforce, and how we look at local authorities as a place that maybe is our strategic jump point, especially now in the coronavirus era. This is in Hebrew, but you can see here a lot of names in Hebrew, and these are the people that we work in collaboration to look at the issue of Arab minorities' health in Israel and to think about what we do with it. You can see people here from civil society, a lot of NGOs that we work with, think with, advise with, and make our plans with, as well as other ministries, as well as the local authorities, which are very, very strong partners. I put this, even if it's not in English, just to say that we really do believe that a as I said in the beginning, cross-sectional, cross-government action is the way to take things forward. And I'll say maybe just 10 things that we are seeing a lot of opportunities with the coronavirus. It's been very challenging, and you heard those of you who were with Adi, who's one of my employees on Monday, heard of the challenges that we have with the coronavirus. But I want to say that there are a lot of opportunities with the coronavirus. I mentioned just shortly the issue of the municipalities in Israel. We really believe that there's a chance to look at municipalities and strengthen them and their part in promoting health and mainly prevention in health. But we see the opportunity to put health, mainstream health, in all of the government, we call it health in all policies, meaning seeing all these partners coming together to work on the issue of the coronavirus, the COVID-19, and see how we could change this or make this permanent and make these joint collaboratives a chance to take things forward. We are working, and I'm going to say this very specifically, we are working with the Ministry of Finance for the past 2 years to promote a governmental decision, a 5-year, very big plan on the issue of health. We're looking at some of these decisions, or the things that we're recommending is working with the NGOs and other sectors to promote the issue of health, not only governmental or HMOs, and looking at all the partners and the strengths and authorities that could take this issue forward. And we're putting this issue very specifically as a demand for the coming elections with the Ministry of Finance to take action and try to, I hope, get enough budget for the things that we're trying to promote. So we're very serious on these issues, trying to say that this is strategic, we're committed to it, and we're looking for partners and coalitions to take this forward.
Thank you very much, Shlomit, for this great overview of challenges and gaps in health, in the medical system, in access to services, in health measures. Dr. Hakim, I'm seeing you nodding your head across Shlomit's overview. So I would like to give you the floor for your presentation, and we can take it from there to Q&A. Fahed, the floor is yours.
Thank you. I share the screen. You see it, right? Okay, so good afternoon or good evening for people in Israel. I'll try, Shlomit gave an overview of what's happening. We know giving the data is something, and living the data is different. So I live it. I can just start with saying I'm a pediatrician myself. I have 4,300 children in my clinic that I take care of. I have families that have actually father and mother that are under dialysis because of diabetes. And you just think about those kids that are growing into a family that they're not just looking for which university you're going to study, they're going to look which unit they're actually going to have dialysis in. So this is the brief that I'm starting with. The mission here is really big, and as Shlomit started, she could give hundreds of options of what's happening around. I'll just give you what we're doing in Nazareth Hospital as a hospital that sits into the middle of this equation of being in an Arab sector. So basically, the Nazareth Hospital is a part of what they call a Nazareth Trust, and it's an opportunity to say that this hospital is here for almost 160 years now, trying to serve the community in multiple areas of serving. One of them is a hospital. We have academic school of nursing near to us, Nazareth Village, that is a tourism area, and again, serving a Nazareth program that comes from all over the world to come to serve the Holy Land as a serving program. As you can see here, Nazareth Hospital sits in the middle of an urban area. It's a huge amount of people around us. It's packed, and this is a part of the problem. It's not just health problem. Health problem won't be solved just of putting health on the top. we need to solve a lot of other problems. You can see there's no green areas in the area. There's nowhere to walk. There's nowhere to have sport. There's a lot of problems that just not healthcare problems that are going to have to be seen. But the hospital sits in the middle, actually in the middle of the area. There's always a saying in Nazareth, when I sneeze here, somebody from downtown calls to say bless you. So it's too much packed into the area. The gaps are huge, literally huge. We actually serve around more than half a million population. It's a small facility. It's a 140 beds facility, but over our land a year, like walk over 1 million people, because there are lots of needs here. So the gaps are not just in healthcare. They come from peripheral gaps. We don't sit in Tel Aviv, unfortunately. It's a sectoral gap, as you understand, coming from the Arab sector, and it's a major problem here. Infrastructure gaps, because the hospital, sometimes 160 years hospital, some areas feel 160 years old. Opportunity gaps, and this is very important, and this is sitting in the periphery of Israel. It's not an easy task to get physicians here, to get all the companies here, and to actually invest here. This is not an easy task. Academic qualification gaps, and again, Shlomit mentioned major problems in a lot of health, but we have, especially in women, we have a very huge gap in qualification in academia, and this is again with the general sector in the country, and this makes the health problems more and more extent. So how we can fill the gaps, and I let you go with what our what we're trying to do here. Again, as we said, partnership. Partnership is actually first of all between us and in Israel, between us in the Middle East, between us and you, between us and lots of populations. But again, when you start looking at the gaps and looking at figuring out, you need to tackle out who is your actually people going to treat. And you need to look at this problem in three extents. One is actually prevention. And we all know financially, economically, this is the best area, to try to prevent the disease of coming. But we know that we're not there already. When you talk about 3 times diabetes in the Arab sector as it is of the general population, it's huge. Guys, in our small facility, we perform dialysis to more people than Rambam Hospital in Haifa and Carmel together. Okay, we have 500 amputations of legs in a year. So these are 500 new people that are actually disabled people that we get them into being not just paying taxes, they're paid by the health system. So basically prevention is the first tax. The second one is taking care of chronic diseases. And then this is something huge. We have in the Arabic population, lots of people that have more than 6 or 7 chronic diseases. And Shlomit didn't mention that, but if even with the life expectancy is lower than the life expectancy of the Jewish population in Israel, even it's every extent, it's getting higher everywhere in the world. And again, the Jewish population is getting higher with the life expectancy, but in the Arabic sector is not. And we know the numbers from vaccination. When we talk about 2 million people that live in Israel, now just 100,000 people are over 60 of age in Israel that are coming from the Arab sector. You imagine that 10%, that's 5% of the population that live in the country. And this is a small, very tiny number. It's not just because we have young kids, but because people don't live that long. And so this is the third part that we need to tackle all the time, is actually the complication of the diseases. And this is the urgent things that hospitals are dealing with, strokes, hypertension, heart attacks, people with amputation, dialysis. This is like really action that actually taking everywhere and every day. So it's hard. It's the time is not easy. But again, the Nazareth Hospital is here to serve the community, and this is what we're trying to do. We call ourselves, it's a health promoting hospital, HPH. We're recognized by the World Health Organization to be one that actually since inception trying to help the community. And this is something weird here, that you're looking for people not coming to hospital and actually dealing with prevention by a hospital task. This is not a task that a hospital usually takes care of. So we are actually connected to community. We go every aspect of the hospital. Every week we have a session talking about something to deal with smoking, to deal with diabetes, to deal with sessions that we can see here going to schools. We have 170 schools that are connected to hospital, and we give them lectures on annual basis on everything you could think about as it is a hospital. You know, we have partners with people here. This is some kids from an orphans that come to give us help, and we give them back the healthcare that is. I'm here. This is my picture here, trying to convince the sixth grader to quit smoking. You imagine that's a sixth grader to quit smoking. So this is literally a mission that seems impossible. But again, we're here not to fail. Okay, so we have a TV shows every day. We are actually investing in something that is not visible here. It's not, you know, it's in Tel Aviv too much and in Jerusalem sometimes, but it's not here in the periphery of Israel, and especially in the Arabic population. When we talk about mental health, and Shlomit had the slide of having 1% of the psychologists in whole Israel speak Arabic. Okay, 20% of the population get from 1%. Okay, so you just imagine how this big is the gap. 1.9% of the mental health specialists as a psychologist, not psychologist, as a psychologist physicians, that they are speaking Arabic. So basically we have a huge gap of the caregivers, not just the people that we need to give them care. In fertilization, you know, this is something huge and a major problem. So this is what we invest in. We invest in unique services that we don't have. Actually, this is facilitating their service. When you say to someone, go to Tel Aviv to take care of your health problem, we know that people don't go. And this is, again, the Ministry of Health data comes and say 1 of 5 of people that live in the periphery of Israel, especially in the Arabic population, don't go to healthcare, don't get healthcare because of economic problem. They just commit not to do so. And just imagine what happens after that. So in the investing in acute services, so the hospital today have a stroke unit, investing in cath lab, something that it's obvious and everywhere in the world, but it's not obvious in our facility, in our area, and the people should be served here around. So how we do that? Actually, we try to get people back. We bring minds home. All the pictures you see here, those are people that used to live in the United States, in Europe, and in Australia, and they left, you know, Royal Brompton and Baylor and NYU and Boston and came back to Nazareth to again serve community. So we have a start. People want to help themselves. Okay, these minds start here, go abroad, get the fellowship, what they need, and come back to serve the community, and not just Arab citizens. There are doctors that are coming from the here, you know, Hebrew, again, Jewish sector, even everywhere from all the world. And partnership, again, when we say partnership, it seems that we're looking for partners all over the world. No, basically start with partnership with the Ministry of Health in Israel. This is not a task that is obvious here. So partnership with the Ministry of Health get us to be an excellent area. So this is our ER, getting excellency from the Ministry of Health. Infectious disease health problems are solved. Patient safety, we're getting a mark of 100%. We're the first hospital in Israel taking, you know, advantages. Again, partnering with the Ministry of Health, partnering with the excellency in our NICU, excellency in our medicine department, excellency of our surgical department. And again, this is a small task. We talked about the partnership together. Academia, it's a huge importance, huge importance. This is our School of Nursing, starting to be the first School of Nursing out of 26 that sit in Israel, with again, excellency from the Ministry of Health. And again, this is something we need to talk about. And again, we can't just build building. It's not capital development management here. We need to have the people to treat, not just the people that need treatment. Again, with academy success, education is a major thing. Research is very important. We are hospital that accredited by the University of Bar Ilan with Sfat, the Israeli digital. We have an innovation center here. We talk about partnership in research, some papers in Nature Medicine, New England Journal of Medicine. This is here our partner from New York, Jeff Drazen, the New England Journal of Medicine editor, and Corona. When Corona came in, COVID-19, you know, we felt bad, but I think this is something that is weird. But in Israel, something happened between the population. Everyone understood that we could have one enemy. And that's the obvious thing that we had today. So what happened in Israel when this enemy came to us, and Shlomit mentioned that, we had an opportunity here. Again, and the Nazareth Hospital was, before that, we didn't have a chance to treat others than people that came to us. So we had victory department, we call them. This is COVID-19 departments. You know, Ministry of Health, Ministry of Finance, and Ministry of Defense came in to help into the Nazareth Hospital. And this is something weird, that we had soldiers working in our facility, again, in the healthcare system. So these are things that we built a tent here for people to attend and have COVID-19, again, tests. And this doesn't happen in any hospital in Israel because people here can't move. The test needed to come to them. This is a tent that like 160 years ago when we started this establishment here. So our biological ER is a huge tent that almost 700 people a day come to us to be tested without any referral. This doesn't happen in Tel HaShomer, neither in Ichilov, neither in Hadassah. This is the only facility in the country that do that. And again, we had a hyperlink, people come and do that. With remdesivir and plasma and others, now today we actually have people coming from Bnei Brak to get those treatments in the Nazareth Hospital. And this is amazing that COVID-19 made this bridge to happen. And today with the Ministry of Health, actually, we're using all this equipment to get the remdesivir from Tel Aviv here, and not just by the bus or by train. Again, laboratory was established. This is everything. It was new with the COVID. The staff was engaged into that. Media, that's a huge gap of translating all the regulation of Ministry of Health. Nobody understood what is Corona before, and we got in, and Shlomit knows that. They sent us the regulations, we translate that, and started working with the media. The Minister of Health came here with the General Director and understood what's happening around, and they gave us a license to actually put a 12-bed ICU into the hospital in the last 3 months, and we were accepting that and going into innovative service, starting with the work, and again, it's already established, again, financed by the Ministry of Health and Ministry of Finance. Again, half of it was financed. We needed to get the other half from abroad, and we had a master plan already on board. So our master plan is a huge master plan with taking care of the facilities here. Again, back to beginning, acute care. We need a huge ER in the area to take care of all the people coming around. This ER is already half of it funded by the Ministry of Finance and Ministry of Defense. That's an amazing thing to think about. Nazareth Hospital financed by the Ministry of Defense. Yes, that's actually happening because we are actually going to do 500 beds underground, fortified, to be again used, hopefully not used in wartime. Again, another 2 buildings. I'm just 1 minute. I'll be finished. Two buildings that I'll be going on board, and the third one is the departments to be built. Another facility that's very important for me and to share about is what we call NIH-RD, the Nazareth Institute for Health Research and Discoveries. And I think this is important to think about all the sector of the paramedical, not just the medical, to treat, not just to treat, is again to educate new people around. You know, the guy in the picture is again Cupertino, United States, Apple's vice president. We're trying to connect Apple International into this thing, and I hope again our facility will look forward into the 923 that hopefully we were going to establish in the future, to look at innovation, to look at the center of excellency, to look at NIH-RD, and again deal with the gaps that fill them fast. And that's it. I think, you know, the best way actually of predicting the future is again to creating it. So thank you very much. I'm sorry for being that fast.
Thank you very much, Dr. Hakim. This is obviously very close to, this is very obviously very personal, and your level of enthusiasm about your work is amazing. Shlomit and Fahed, we were both we were discussing about gaps in health in 2 different ways. In a way, top down, Shlomit, during your presentation as Ministry of Health, how does the state sees and understands gaps in health in Arab society, structural gaps between different groups within Arab societies in Israel, differences in health measurements between northern and southern Arab population in Israel. And Fahed, as a professional in the field and as the director of a hospital serving most the Arab population in the biggest Arab city in Israel. We've been hearing many things in many ways, in many different ways, about how COVID also provided opportunities and not only brought further difficulties. And I would like to refer to those opportunities in two different ways. One is in the aspect of the relationships, the relations between the medical system, the Ministry of Health, hospitals, the clinics, and the local population, the public, the regional councils, the collaborations between the medical system and civil society organizations. And the second, in the sense of highlighting the need in further training of medical workforce, medical and paramedical workforce from the Arab society itself. We all understand very well that one of the biggest challenges we have in public health, and focus on narrowing gaps in health in Arab society, is medical and health literacy in Arab society. People's approach, people's relations with the medical system itself. And one of the ways to narrow such a gap in medical and health literacy is by training further workforce, more and more workforce, specifically in the paramedical field from the Arab society. So if you could both please elaborate on that. First, in the sense of collaborations between the medical system and the Ministry of Health with the public, with civil society organizations, the Arab public, local government, and in the sense of the huge lack of workforce and what that can contribute, not only in the sense of narrowing gaps in health, but also in the sense of growth within the medical system. Shlomit, you wanna open?
Yes, I can try. We've been working very closely with the NGOs and civil society in the Arab population in Israel, as well as the academia. When I mean working closely, I mean that, as I said, they were part of the plan that we are going to submit to the next as a government resolution and next government. But we're also working closely with them to promote the issue of the COVID-19, whether it's to speak with the population about the risks, to promote vaccinations amongst the population. We've been doing this in two different ways. One, we join up with NGOs and we provide them money to do this, but we also work with their volunteers, and sometimes these joint actions aren't funded. So some of these actions are funded, some of these are not, but they go much farther than the issue of explaining the issue of COVID-19 and other things. They go to community work, community care. I think some of you that were in the meeting on Monday probably heard that what we did was work with the philanthropy in Israel to get money to try to support 400 requests that we got from civil society and community grassroots, etc., that are already working with the issue of COVID-19 and doing a lot of community work. So our commitment as a government is to try to give them the tools, whether it be money, whether it be data, whatever we can do, whether it be promoting collaborations between them or between other ministries. So we work with civil society very, very closely. Regarding the issue of healthcare, I can say that Fahed said earlier that the issue of health is not only health, and it has to do with education and income, etc. And that's the way we also look at health. So our governmental plan is based on collaborations with almost all ministries. And I'll give the example of the Ministry of Health and the Council for Higher Education. We've been working with them to talk about how we get more Arab students going to learn psychology or psychiatric or other health issues that are understaffed. So we've been doing this together, and this is part of the way we look at things as, again, as something that is not only health, but is as joint collaborations between ministries. And this is one of the things that we've prioritized, the issue of healthcare.
So both your relations with the Arab public in the sense of volunteers, for example, in the civil network, the civil network against COVID, and your work with local government are part of the Ministry of Health plan for narrowing gaps in health, or are those things that you do regardless of the plan that is proposed to the Ministry of Finance?
The way we do things in the Ministry of Health when looking at health disparities in general, whether it be with the Arab Society or the ultra-Orthodox or people living in poverty, is by looking at collaborations as one of the things that we promote. We truly believe that government alone cannot do the work, neither do the HMOs, and even Fahed can't do it all alone, because and we have a great health system, don't get me wrong. The HMOs are very, very, very strong. They do amazing work. So do the hospital system. But we can see that things like health promotion, as Fahed said, are very difficult to do through a hospital or through HMOs. We need community work. The issue of community work is vital when looking at the issue of health promotion. We've been seeing things that we've not been doing well. And this is, as you know, a system with inherent shortage. So money is always an issue. We need to work with the money that we have in a very smart way, using all the forces together. There's obviously also issues of trust with government in the Arab population. And I think you all know this. And the way to overcome this and to make trust or work on the issue is with community workers and with the NGOs. So they're not only professionals in our eyes who know the issues and how things look on the ground, but they're also our communicators with the community, and they're able to do things. I'll tell you this, during COVID-19, we've worked with NGOs in the South and in Eastern Jerusalem, and we did not put our logo, although we paid for the work that they did, because we thought that what's important is to get communication on COVID-19 out there, even if there's no MOH logo, and even if it's our money, because we believe that they can make the connections and do the work that we sometimes cannot do. So yes, this is incremental to good work on health disparities.
Thank you, Shlomit. Thank you. Thank you for clarifying this as well. Fahed, again, I'm seeing you nodding your head, and I'm sure you have a lot more to add. Please go ahead.
First of all, again, I'm a physician. Again, when dealing with things, we need to have diagnosis first. And what Shlomit is actually implementing is the diagnosis today. We have a very sick patient, okay, and we need to treat and to treat today. Okay, we can't just get this to be exaggerating the situation more and more. And again, collaboration and partnership is the word here. The Arabic population alone can't do it. Any hospital alone can do it. And even the Ministry of Health alone can do it. Okay, so basically, again, my facility here, we talk with Ministry of Health, we talk with Ministry of Finance, we talk with Ministry of Defense, we talk with Ministry of Equality, we talk with Ministry of Galilee and Negev, we talk with everyone, with Ministry of Education. We trying to understand that this is a huge gap, and filling it is not an easy task, and it would take time. Okay, our patient is very sick. Some of those things are acute, and we need it in the short term. You know, when COVID is here, we can't say, okay, wait, COVID, we can't have facility in 5 years. It can't work. But we know that for sure, we can't close the gap in psychiatry in 3 months. That won't happen. Okay, we need psychiatrists, we need psychologists. That will take years. Okay, so but the gap is here, and again, it's becoming more efficient and more problematic. So the problem in health at the end of it, it's economic. It's economic because it starts with finance, it ends with finance. You know, today when I get someone that is a patient today, you know, in Arabic sector, the major problem we said, we don't have people that come to be elderly people, but this is not problem of economy. If you, sorry for the word, if you die after the age of 67, that's good for the country because at the end of it, they don't pay you back. Okay, but what we have here is people that are very sick between the age of 40 and 67. And on pension, before pension, we have people that are disabled and the country is paying them and they're not enjoying, or it's not enjoying that their productivity. So what we have here is getting back the people to productivity. And this will, at the end, will help everything. One of the major problems in the Arabic population is actually literacy for healthcare. The people don't know how to deal with the health care system. And probably in the United States, I lived in Chicago for a while and in Palo Alto. And again, it's obvious that if you can't know where is the health system and how to take advantage of it, you'll be more sick. And again, trust is a very important word here. And again, we should understand that the Arab population, you know, accuse the government of Israel of this gap. Let's face it. We're not just here to say nice words, but at the end of it, we understand today that every governmental minister, and again, even in the Knesset, I was in all, as you can imagine, any activity around that. In the Knesset, I was sitting in the head bank in Israel with the Minister of Finance, Minister of Health, of everyone. And now today, they understand this is something we can't just keep it happening. Okay, so we need to be tackling it, as Shlomit said, one of their slides. There are actually really hundreds of people that into this activity. And today I have to say one thing very important. In the Arabic population, there are people that are willing to help treat the Arabic population. It's not just waiting for others to give the treatment, but it needs to be financed. At the end of it, sorry for saying that, again, without any budget, we can't deal with anything. I can't build any building, I can't educate anyone, and still, you know, looking for small pocket money to help the population. And this, at the end, will end up with more people, sick people, and with less productivity. And I said that in the Knesset a couple of days ago. You know, even our F-15 pilot, if he has diabetes and he has hypoglycemia, when he's flying the airplane, he will fall down. So basically, it's a major thing. We need everyone to be healthy in order to have productivity. And again, initiative. This is, I think, what I have to say about the question.
Thank you, Fahed. Thank you, Dr. Hakim. There are many questions going on in the chat, but we've discussed a very broad variety of gaps, medical gaps, gaps in access to medical services, gaps in language, lingual gaps, gaps in cultural adaptation of services that are already being provided to our population in Israel. I'd like to ask, what would you say are the top priorities here? I mean, there's so many points to discuss here, both in the sense of training of workforce, both in the sense of collaborations with civil society and local government, needs, very broad needs in training Arab society in both health and medical literacy, and training further people in paramedical professions. What would you say are the top priorities for closing those gaps? Where would you begin? This is an open question to both of you, Fahed and Shlomit. Would you go for workforce development, creating further infrastructure? How would you prioritize such a field?
So ladies first, right?
If you insist. People also say age before beauty, right? Or well, Ilan, this is not maybe like a natural answer, but I'd say all of the above. I'm very serious about what I'm saying now. We're looking at all these issues as a marathon, not a sprint, meaning we have a 5-year plan, and it focuses on all of the things that you've mentioned. But you did see in my presentation, I'll be happy to send it, and you can see, you know, you can see the plan as a whole. we did make some choices there. We looked at diabetes and the issue of overweight, the issue of mental health, the issue of women's health, the issue of smoking, and early years. These are our strategic vocal points. But again, they are cross-sectional with the issue of the workforce. Again, workforce, we don't think there's a problem with physicians or nurses, but we do think there's a problem with mental health workforce and generalists, which aren't specialists. We do think that the issue of infrastructure is maybe not a general issue, but it is an issue when looking at things like rehabilitation infrastructure or mental health clinics in the community. So these are all cross-sectional, and we'd like to look at them, at all of them as a 5-year plan that we're going into. But some of these things have to be before others. For example, the issue of workforce is something that we'll prioritize because we're talking about, getting a psychologist out to work. We're talking about, at least Fahed knows better than me, how many years, Fahed? 8, 7, 4?
No, 7 years. 7 years.
7. Okay, and not to mention psychiatrists and etc. Okay, when looking at diabetes, we talk also about the issue of dietitians. We don't have enough of them in the Arab population. So these are also always cross-sectional, and the way that we deal with these issues is again through looking at the structural issues, meaning what we as government can make or do better regarding the opportunities that our populations have, but we also look at things from, as you said, bottom up. It's not only top down. The bottom up is crucial to the issue of health promotion, as I said, to the issue of diabetes, overweight, and bottom up is municipalities and civil society. These are the two main issues.
Thank you, Shlomit. And maybe just to provide even more further focus in all these different fields that work needs to be done in order to narrow gaps in health. Was there ever any reference, workforce, infrastructure, collaboration to one of those fields in 922 or one of the previous development programs in Arab society?
Well, Fahed knows 922, I think, better than me, because the only decision in 922 regarding health has to do with the Nazareth hospitals. And this has, I'm wrong, Fahed?
Wasn't budgeted, but it's like
but it wasn't budgeted. Okay.
And
there were a few. There are 3 more resolutions, doing with 2 in the north of Israel and 1 in the south of Israel, which has to do with the Bedouin population. But again, the issue of health is very minor. It's not that it's not there, but it's very minor. We are, as I said, in collaboration now with the ministry, which promotes the issue of a 5-year plan for the Bedouin population, which is different, though it has connections with the general Arab population decision going forward, which is a different ministry. It sounds confusing, but Ilan, maybe you'll explain to people why it's like that someday. But we're working with both ministries on both plans, meaning general Arab population and the Bedouin population. And I can tell you that the opportunities, again, that the Corona made, I think maybe 2 or 3 years ago, Fahed, I don't know if you'll agree with me, but we had to run after other ministries to say, listen, you have to promote health. You can't only talk about, I don't know, other issues regarding the Arab population. You cannot ignore health. And now they're running after us. They want us to sit with them on these plans, because they understand how crucial this is. And I'll say just one more thing. There is something going on that's not out there yet, but we've come together, some seniors in a few ministries, to talk about social mobility in Israel and try to promote a government decision on the issue of social mobility. And it's very clear there that the issue of health is crucial to social mobilities of minorities in general and the Arab population in Israel. One of the things that people see as an opportunity is the issue of workforce, because again, it goes not only to getting better health outcomes, but it also talks about very good income for people going, to become a physician or a nurse, and it's stable, etc. So this is a win-win situation, and people are understanding this, what wasn't obvious, again, 2 or 3 years ago.
Thank you, Shlomit. Please, Fahed, go ahead.
Shlomit, the Minister of Health this year was the Minister of Defense, so that was the easy task. Everyone was running after you, so need to take advantage of that more and more. I think, again, going back to gaps, I don't think all the gaps should be closed. Some of them will be actually with time closed alone. So there are lots of gaps, but basically, I look at it in the sense of what we call the phases. Something acute has to happen. Something today has to happen, and I think it's based on two things. One is the infrastructure. Again, capital development. This is based on trust. If the government or start investing into the actually in the Arab community with even build the buildings, even a new whatever new facility in the HMOs, something that should be again seen by the population. And getting the infrastructure of when we say infrastructure, again, it's facilitating the services. When we talk about ambulances services, again, David, it's not easier to come into the Arab sector. So we have lots of things to deal with, basically. In the mid side of it, I would say, again, dealing with, as Shlomit said, with chronic diseases and acute, or complication of the diseases, and putting plans into that. Having centers for trauma centers, for acute care. People shouldn't again think if they have a stroke where to go. They should have a facility nearby to be dealing with this complication. And on the long run, I think education is the word here. Education. Again, educating the public how to use healthcare facilities. We have in the area here around 70% of the people that have the extra, how they call it, the mushlam, the healthcare.
The membership, the extra membership.
It's 70, but there is no place to actually be activating that in the area. So we need to transfer to go commute to Tel Aviv in order to be taking advantage of something that you just buy and you don't consume. So this is another issue on education, as you mentioned, Ilan, and again mentioned by Shlomit too. We need to educate the paramedical side, the dietitian, the area, and if you saw in our master plan in the hospital, as we're working together with the Ministry of Health, looking with we have the academic school of nursing that is almost here 100 years. Okay, was actually expanding it of happening to have all those dietitians, psychologists, social workers, and paramedical, everyone, that we can actually expand that and give back the caregivers, and not just the people that to be giving care for. And again, I go back to COVID-19, and Shlomit is right. There are lots of areas in the Arabic population that trying to help. 1 out of 4 of the healthcare providers in the Arabic society, in the Israeli society, comes from the Arabic sector in the nursing area. 40% in the pharmaceutical area. So there is today there are lots of people that come to be part of the Israel as an Israel. Is not just a part of one sector as opposed to other sector. And again, looking at one question here about the Brenda is asking about the medical students. Yes, a lot of medical students want to study medicine from the Arabic population, but mostly they're studying abroad. So there are 16,000 Arab students that study abroad. 6,000 out of them study in Jenin, like this is in the Palestinian Authority. And this is another gap, that putting here, this is something weird that they pay around 30,000 shekels a year for their education we can do it here in Israel, and 180 million shekels are actually invested in university a couple of miles from the Israeli border, let's call it. But something could be happening here, and I know that Ministry of Health, Ministry of Finance, and others are working toward closing those gaps. And again, in the medical field, we know, my sister is another, as an officer in the Ministry of Health, working in education too. So we're working together, and we can see that a lot of people that come from abroad, from medical students, there are 12,000 students that finished schools in abroad of Israel, and they're waiting to be working, what they call the exam in Israel, the board exam, 12,000, and they won't go over this exam. 8% out of them at the end, find themselves just going, the exam, passing this exam. This is again a shame. Even a family member that go abroad, you invest in him 7, 9, 8 years and come back, and after that he's a taxi driver. That's it's not easy task, or stay abroad. So that's we need physicians here, but I think we need to be investing in them in Israel, because the medical system here is amazing, and the education system is even better.
So Fahed and Shlomit, huge thank you for joining us and providing these insights, especially on a Thursday night after a tough week of struggle against COVID in the medical system in Israel. Thank you so much. What I'm taking from this very initial discussion of the issue of narrow gaps in health is two things. One, in order to make a significant change, we need the Arab public. We need the Arab public in many different ways. Local government, civil society, training of workforce. This is something that cannot only be done top down. And the second thing I'm taking from this conversation is COVID is a disaster, but it had also provided us with some great opportunities for integrating Arab society into the medical system, into narrow gaps in health in Arab society. Thank you very much. Liron, any concluding words?
Yes, just thank you for everyone who stayed for this hour. Thank you, Shlomit, Dr. Hakim. This was intended to be a conversation starter. We're going to share the recording with the Foundation Forum. There were a lot of really interesting areas of potential intervention raised. I invite participants here today to write us to say we're really interested in the paramedical professions and the education in Israel, in the workforce development, in infrastructure, in access. Tell us more about what it means to be part of national health services. This will help guide us in what to bring as we dive deeper into this issue going forward, to tap into the opportunity that COVID created to close some of these gaps and draw the connections. And that's
next time you're in Israel, you need to come to visit us, probably Jerusalem and Nazareth.
Yes. So thank you so much, Shlomit and Fahed. It's really good to.
Thank you, and we're open for questions and any further discussions. Thank you so much.
Yeah, thank you. Have a good evening and
Good evening.
Thank you, everyone. Thank you, Fahed. Thank you, Shlomit.
Thank you.
Liron,
Thank you.
Great job, everybody.
Thank you,
Thank you, everybody.